In the first latch video, you learned how breastfeeding is like eating a burger. Before your baby's mouth contacts your nipple to latch on, place your baby's head and body in a position that makes it easy for him to open his mouth wide for a deep latch and work his jaw muscles to remove milk well without causing pain. Before latching, sit comfortably and let your breast just hang there. Remove fabric that brushes your baby's cheek and distracts the rooting reflex. Always bring your baby to your breast, not your breast to your baby. Note where your nipple naturally rests. First, position your baby with his nose at your nipple without touching your breast. You'll support your breast in a bit. This is your view looking down at your baby while using the cross cradle hold. Your left hand supports your breast and your right hand supports your baby. This is how you look doing the football hold. It's basically the same, but facing a different direction. Grasp his neck with your thumb on one ear and your finger on the other. Don't push on the back of his head, as this will push his chin down and mouth closed. If your breast is large, your left thumb and finger shape the breast like a sandwich to fit in your baby's mouth. Shape the breast like a burger to line up with your baby's mouth. Like this, not this. If your breast is small and perky, don't grasp your breast from below, as it'll be in the way, so your left finger isn't needed here. Either way, your thumb will pull the skin to tip the nipple. This creates a bubble of breast tissue for the bottom lip to snag. As you bring him onto latch, push his back and chest into your breast. This movement tilts his head back a bit, pushes his chin into the breast tissue, and lands his bottom lip away from the nipple. As your baby moves onto the breast, the bottom lip snags on the bubble of breast tissue and curls out. The lip curl and the space between the lip and nipple are key points. Make sure your baby approaches the breast from this way and not straight on like a target. Now to pull it all together, as there's a lot happening at the same time. First, nose to nipple. Tip the nipple. Push his chest in. As the bottom lip contacts the bubble of breast tissue, nudge his back with your hand and release the tipped nipple. The lip curls out as the skin of the breast moves. Make sure the bottom lip doesn't slide up next to the nipple. Your nipple and baby's lip slide past each other, so the lip lands next to the nipple. The nipple is at the suck reflex at the roof of the mouth. Ideally, there is space for the tongue to stroke between the nipple and bottom lip, which curls out. The cross cradle hold works well for newborns and small babies, or any who have difficulty latching. You'll support the head so he can open his mouth wide. Your other hand deals with your breast if it needs supported. With the cradle hold, your baby's head rests in the crook of your arm. This usually works well for term newborns and older babies. Sometimes the head will fall away from the breast, or their chin will tuck down, which closes their mouth. Some moms and babies fit together better in the football hold. Put a fat pillow behind your back to create space on the side for the legs to extend behind your back. This prevents him from pushing off the back of the seat. If you have larger breasts, which hang down to your baby's mouth, he can lay flat. If your breasts are small, lift your baby's shoulders to push his chest into you while allowing his head to tilt back with his chin up. These tips work well for all nursing holds. They'll just look a bit different from the outside. It's good to switch it up over time, as different holds put the tongue at different pressure points on the nipple. Side lying allows you to rest while nursing. Laid back nursing can enhance a newborn's reflexes to latch and is often used during the hour of skin-to-skin time after birth. Once latched, double check a few things. There should be space between your baby's chin and chest. If not, press his chest in closer and his head will tilt back. His chin tips up so his mouth can open. A straight line should pass from his ear to shoulder to hips. Thus, he's not twisting his hips, nor is he turning his neck to the left or right. This focuses his muscles so he can nurse most effectively. Your baby was born with his muscles flexed, which includes his elbows. This can be annoying because his hands will get in the way. Tuck the bottom hand and flexed elbow under your breast. His arms will relax over time. I hope your baby naturally performs well so breastfeeding is easy for you both. Keep trying. I hope these tips help.